So what about yesterday's topic? It is clear to everyone.
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay. Today, today. So today I will first of all give a little revision and some clinical correlations relating to the penis, the circumcision, and its some disorders I will explain which are important. Okay, but
Yes,
before going to that, we will go for a little revision again. We will start from here. Okay. Yesterday I explained to you this diagram. I explained to you this is the cross section. Then we have superficial fascia. Then we have deep fascia, that is the Buck's fascia. Under the Buck's fascia, we have three these structures, two
No, sir.
carpus cavernosum, and one we have carpus spongiosum. Okay, two carpus cavernosum, one carpus spongiosum, and we yesterday said that these right and left grooves of the penis, for example, these are covered by cavernous muscle, and this bulb of the urethra or bulb of the penis, not bulb of the urethra, the bulb of the penis, it is covered by
Bulbospongiosis.
Bulbospongiosis.
bulbospongiosis muscle. Okay, so cavernous muscle, right and left grooves of penis. In female, it will form right and left grooves of the clitoris.
Clitoris.
Okay, bulbospongiosis muscle covering here the bulb of penis. In female, it is covering the bulb of the vestibular organ. Okay, now uh, this structure it is known as glans penis. Okay, now this whole structure, for example, here it is covered here by skin. Okay, that is known as foreskin, or it is also known as prepuce. Okay, it is known as prepuce. Okay, at the tip of the glans penis, you have an opening, that is your external urethral opening or external urethral orifice. Okay, now what happens sometimes, for example, yesterday we are talking about circumcision. For example, see here on the tip of the glans penis, you will find the external urethral meatus, and this glans penis, it is covered by prepuce or foreskin, which is covering this glans penis. Okay, and on the lower side, it is attached to each other by the frenulum. Now it has two surfaces. For example, if I draw here like this, okay, it has two surfaces. This upper surface, it is the dorsal surface. Okay, this lower surface, it is the ventral surface. Okay, so this is the dorsal surface, this is the ventral surface, and on the tip you can say there is an external urethral orifice. External urethral orifice. Okay, and it is, for example, this structure here, this is known as glans penis. This part here, this is known as corona, not coronavirus, this is corona. And now this is here covered by skin. All this skin can be retracted. This skin is known as prepuce or foreskin. Okay, it is known as prepuce or foreskin. Now, what is important here, sometimes, so this is the dorsal surface, this is the ventral surface. Sometimes what happens that in the dorsal surface here, the urethral opening opens, or the urethra opens here. Okay, so if the urethral opening is on the dorsal surface, okay, we called it as epispadiasis. Okay, it is known as epispadiasis. Okay, if this urethral opening is on the ventral side, okay, if it is on the ventral side, then we will call it as hypospadiasis. Okay, it is known as hypospadiasis. Okay, so now see here, this is your penis, for example. This is the external urethral orifice. This is the glans penis. Now it is opening here externally normally. But what happened? If it is opening on the dorsal surface, you can also call it as the abdominal surface. Ventral surface you can also correlate with the scrotal surface. Alright. So which is under, for example, here your scrotum is present, for example, so this will be the scrotal surface. It above here will be the anterior abdominal wall, so it will be the dorsal surface will be the abdominal surface. So please remember, if dorsal surface urethral opening if urethral opening is on the dorsal surface, it is known as epispadiasis. If it is opening on the ventral surface, it is known as hypospadiasis. Okay. Now, what is circumcision? Circumcision is the removal of this foreskin or prepuce. Okay, so when you remove this foreskin or prepuce, what happens? This glans penis will remain. For example, if I draw here the diagram, wait here everyone. For example, if I draw here the diagram like this, for example, this is covered by whole foreskin. So what we have to do, this foreskin, for example, first of all, we have to retract. When we retract, it will go backwards. When it go backwards, now the skin up to the glans penis, up to the corona, we have to remove it. When we remove it, this process is known as circumcision process. Okay, this process is known as circumcision process.
Circumcision
Process.
process.
Circumcision process. It is most commonly done in the Muslims, in the Jews, but now scientifically it is also said that this part of the skin, the foreskin and the prepuce, it is a most common site for sexually transmitted diseases. Okay, it is the most commonly site for sexually transmitted diseases. So a patient gets sexually transmitted diseases, they immediately ask him to do circumcision process. Okay, so this
Yes,
is
sir.
the circumcision process which mostly performed in the surgical department. Now one more condition is relating to this skin, this prepuce, or this you can say the foreskin. It is, for example, this condition is known as phimosis. Okay, it is known as phimosis. What is phimosis? If anyone is asked you, it is a condition in which the foreskin or prepuce cannot be retracted. For example, if this is the penis and this is the foreskin of the penis, if it is not retracted, don't go backwards, it is not retracted and you cannot reveal the gland penis, then this condition is known as phimosis. Okay, it is known as phimosis and it is a risk factor for sexually transmitted diseases. Okay, it is a risk factor for sexually transmitted disease. Another disease is correlating here that is known as paraphimosis. Okay, paraphimosis. What happens sometime? The skin of the gland penis here, this foreskin or prepuce, it can be retracted backward, but when it retracted backward, it make a fibrous, very tough fibrous band here, and now it will apply severe pressure on the gland penis. And when it applies severe pressure on the gland penis, it can result in penile ischemia, can also result in necrosis and gangrene also. Okay, so in that condition also we have to remove this foreskin or the prepuce. Okay. So in relation to this foreskin or prepuce, you have to know four conditions. Okay. Not four conditions, two conditions. For example, one is phimosis, second is paraphimosis. Then you must have to know what is spadiasis, and what is hypospadiasis. Okay. It is clear to everyone.
Yes, sir.
Yes, sir.
Okay. So this is
Yes,
very
sir.
important. Number one point today's. Now see here, this is in this diagram, it is showing here the glans penis. Okay. Now this is the corona, and now here the skin is retracted. So when it is retracted backwards, for example, when we completely retract it, we will make here an incision and remove that foreskin or prepuce. So when you remove that foreskin or prepuce, we call this procedure as circumcision process. Okay, but please remember, if this skin is not retracted, it's still covering the penis and it is not retracting, not going backwards, not retracting. It is known as
Phimosis.
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 It is known as phimosis.
Phimosis.
And paraphimosis is what? It is a painful constriction of glans penis. It is a painful constriction of glans penis due to constricted phimotic foreskin, okay, which results in penile ischemia, gangrene, and necrosis. So you must have to know what is phimosis. You must have to know what is paraphimosis. Then you must have to know what is, for example, epispadiasis. For example, epispadiasis, it is opening of the urethra on the dorsal surface. So this is the dorsal surface at the moment. Okay, this is the dorsal surface. So if urethra is opening somewhere here, if I remove this whole diagram here, for example, this is the normal opening of the external urethral meatus. But if it is opening somewhere here, this is the dorsal surface. This is the dorsal surface. So we will call it as epispadiasis. Okay, it is known as
APS.
epispadiasis. And when it is in the lower portion, lower part, okay, on the lower part or on the ventral side, then we will call it as
Hypospadias.
hypospadiasis.
Hypospadias.
It is known as
Hypospadias.
hypospadiasis.
Hypospadiasis.
Hypospadiasis. Okay. So if urethral opening on the ventral surface, hypospadiasis. If urethral opening on the dorsal surface, it is epispadiasis. Okay. Clear this point?
Yes, sir.
Yes, sir.
Yes,
Yes.
sir.
Okay. Okay. Very good. Very good. Very good. Very good. Very good. Okay. Now we must have to discuss about male urethra, and we are going to see one diagram, or first of all we can draw it ourselves, then I will show you the diagram. Okay, now all of you now knows about the pelvic diaphragm. All of you right at the moment know what is urogenital diaphragm. All we must have to do is to place the parts of urethra through all these diaphragms. Okay. Now we are going to make a diagram, and then we are going to correlate the structures with this diagram. Okay. For example, number one, I am drawing here. Okay. I will draw here. This is our urogenital diaphragm. What is this?
Urogenital.
Urogenital
Urogenital
diaphragm.
diaphragm.
Urogenital diaphragm.
Urogenital diaphragm.
Okay. I am not going to ask you, but you must have to know which two structures are forming urogenital diaphragm. All of you must have to know now. It is formed by deep transverse perineal muscle
Transfer
and
parent
external
External
urethral
External
sphincter.
urethral
urethral
sphincter.
Okay,
sphincter.
very
sphincter.
good. Okay. Now I have to make here a structure like this, and now I will pass it from this like this. Okay, my diagram may be not very good, but I will try my best to make my diagram in such a way so that it will be clear to all of you. Okay, like that. Here I will have made another structure. Here I will make another structure. Here I will make another structure. Okay, something like that. Here I will make another structure. This structure is pubic symphysis. From here you have your two fascias coming out, Camper's fascia, Scarpa's fascia. Okay, I'm not going to go through the Camper's fascia. I am just going with the Scarpa fascia. Okay, like that. Okay, here also something like that. Like that. Now, this structure here, this structure here, this is our perineal body. What is this?
Perennial
Perineal,
body.
perineal
Perineal
body.
body. I explained to you three structures. See here, pelvic diaphragm, urogenital diaphragm, and perineal body. Perineal body. Please remember these three structures. Perineal body 1, pelvic diaphragm 2, urogenital diaphragm 3. These three structures are giving the most excellent support to the pelvic organs. Okay, to the pelvic organs, to the perineal organs, they are giving maximum support. Okay, now from here I draw one structure like this. I will draw one structure like this. Okay. Now this is our pelvic diaphragm. What is this?
Pelvic
Pelvic
diaphragm.
Pelvic
diaphragm.
Pelvic
I'm not
diaphragm.
going
diaphragm.
I'm not going to label it here. Okay. This is our urinary bladder. What is this?
Urinary.
Urinary
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 bladder.
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 And this urinary bladder, this is our peritoneum lining. Okay. Peritoneum. Peritoneum. Okay. Now see here. This is part number 1. This is part number 2. This is part number 3. This is part number 4. This is scrotum. Okay. Now this scrotum. If this is scrotum, this will be the Colles
The
fascia.
Yes, sir.
Which fascia?
College
Colles.
fascia.
Colles
Fascia.
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 Okay. Now see here. Now see here, everyone. Uh, this number one structure. This number one structure. It is your prostatic urethra. What it is?
Prostatic
Prostatic.
urethra.
Prostatic urethra.
Prostatic urethra.
Number two structure. It is your membranous urethra. What it is?
Membranous
Membranous
urethra.
Membranous
urethra.
Membranous
urethra.
urethra.
Okay. Number three. It is our bulbous urethra.
Bulb.
Number four. It is our penile urethra. Okay. It is our penile urethra. So see here. But we will divide it into three parts mainly: prostatic urethra, membranous urethra, and penile or bulbous urethra. Okay, like that. Now see here, if I am going to ask you, this is the prostatic gland. See what it is? This is the
Prostatic
prostate
gland.
glands.
Prostatic gland.
Okay, or prostate glands. These structures which have formed here, the red ones, this is your
Bulbourethral.
this is your internal
Bulbourethral.
urethral sphincter. You have two sphincters here also. That is your external urethral sphincter. Okay. So in the males, there is internal urethral sphincter and there is external urethral sphincter. In the females, they have only external urethral sphincter. The internal urethral sphincter is not as much developed. Okay. Now, very important point. If I am going to ask you which structure or which part of urethra is present in the urogenital diaphragm, Ramsia, what will be your answer?
It is membranous urethra.
Very good. Okay. Now, Muskan, if I am going to
Yes,
ask
sir.
you which part of urethra is present above the pelvic diaphragm, it will be which urethra?
Above prostatic urethra.
Prostatic urethra. Now I explain you that everyone see here. This is our which pouch?
Superficial
Superficial
perineal pouch.
Superficial
perineal
Superficial
Very
pouch.
perineal
well.
pouch.
pouch.
This is our which pouch?
Deep
Deep
perineal pouch.
perineal
Perineal
pouch.
pouch.
Very well.
Deep perineal pouch. Okay. Now this is our which membrane?
Perineal membrane.
Perineal
Inferior,
membrane.
Perineal membrane.
inferior
Very good. This is our
superficial urogenital
perineal
diaphragm.
membrane. Okay. This is the superior layer of urogenital diaphragm. This is the inferior layer
Inferior
of
layer of
Inferior layer.
urogenital diaphragm. Right?
Yes, sir.
Now,
Yes, sir.
Yes, sir.
okay, this is also here somewhere attached with the prostate. Okay, this area is known as space of Retigus. 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 Okay, okay, leave it at the moment. Now, this is our superficial perineal pouch. This is our deep perineal pouch. Now, what is important here now? In the males, in the males, we have a gland present here. What is the name of that gland?
Bulbourethral
Bulbourethral.
gland.
Very good.
Bulbourethral.
That is bulbourethral gland, or also known as
Cowper's gland.
Cowper's gland.
Cowper's gland.
Okay. So Cowper's glands or bulbourethral glands are present in the males in the deep perineal pouch. But please remember, it is present in the deep perineal pouch, but it is opening in the penile or bulbous urethra in the
bulbousary.
superficial perineal pouch. Okay, it is clear.
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay, but when we study the female structure, we said that in the superficial perineal pouch, the females have what?
Great vestibule.
Vestibule.
Greater vestibular
Vestibular.
glands of Bartholin, right?
Bartholin gland. Yes, sir.
So
Yes,
this
sir.
Yes, sir.
greater vestibular gland of Bartholin are present in the superficial perineal pouch.
Perineal
Okay,
pouch.
but it is not present in the males. In the males, we have bulbourethral gland, which is present not in the superficial perineal pouch. It is present in the deep perineal pouch, and when it is present in the deep perineal pouch, its duct is opening and its secretions are entering into the bulbar urethra. It's clear to everyone?
Yes,
Clear to
sir.
everyone.
Yes, sir.
Now, very important point. This external urethral sphincter, it is innervated by pudendal nerve. So you can control your urine. Okay? But please remember, the internal urethral sphincter, it is not under your control. Okay? It is under
Yes,
your
sir.
autonomic nervous system. And if you want to ask which fibers, especially the L1 fibers. Which fibers?
L1
L1
fiber.
fiber.
Especially the L1 sympathetic fibers. Okay, so please remember L1 sympathetic fibers are innervating your internal urethral sphincter. External urethral sphincter, which is present in the deep perineal pouch, which is a part of urogenital diaphragm. It is innervated by pudendal nerve, which is the only nerve of your whole perineum region. Okay, it is clear? It is
Yes, sir.
clear?
Yes,
Okay.
sir.
Okay, I now
Yes, sir.
stop this demonstration and I want to show you a good picture, not like my picture. Can you see this picture, everyone?
Yes,
Yes,
sir.
sir.
Okay, now see here. Internal urethral sphincter, it is
Yes,
under
sir.
your control?
No.
No,
No,
sir.
it
L1
is
fiber.
not under your control. L1 sympathetic fibers. This is our prostate gland. This is the prostate gland. Okay, this is your deep perineal pouch, which is formed by, see here, external urethral sphincter. See here, it is skeletal muscle. Skeletal muscle means it is under your will. It means it is innervated by pudendal nerve. Pudendal nerve का रूट वैल्यू क्या था?
L1 S2 S3 S4.
S2, S3, S4. Now see here, see here. This is the This is the prostatic part of urethra. This is the membranous part of urethra. And now this is the, see here, this is the spongy or bulbous part of the urethra. See, this is the spongy part of the urethra. Okay, and if you see here, these are the bulbourethral glands. The bulbourethral gland are present in the deep perineal pouch, but its ducts is opening into the superficial perineal pouch. Superficial perineal pouch. So this question was asked many times, that superficial perineal pouch, which structure is present in the female? It is the, which structure? Vestibular, great
Greater
vestibular
vestibular gland
gland
of
of
Bartholin.
Bartholin. It is present in the superficial perineum, but in males, the bulbourethral gland is present in the deep perineal pouch, but your your duct
Opens
is
into.
opening into the superficial perineal pouch. It is clear to everyone?
Yes, sir.
Yes,
Yes,
sir.
sir.
Okay. Now see here, sometimes what happens, this prostate gland increases in size. That condition is known as benign prostatic hyperplasia. And it is mainly involving the median lobe. Which lobe? Median lobe. For this
Medium.
process, we will go for a procedure known as TURP, transurethral resection of prostate gland. We will enter our scope from here. See here, from here we will go here. And when we reaches here, Now we must have to remove the prostate gland from here. We must have to remove the prostate gland from the hair. But remember one thing very, very important. This prostate gland is here covered by a capsule, which is the capsule of the prostate gland. And when the surgeons are operating or removing the prostate gland, for example, it is occurring in patients in males above 65 or 70 years of age. So in this age, their main function is to urinate, not main function is reproduction. Okay. So what they want is when this prostate gland increases in size, it will apply pressure on the prostatic urethra, and the patient will cannot pass the urine. So by doing this surgical procedure TURP, we will enter through here, and now we will remove all this prostate gland. When we remove all this prostate gland, we are very careful not to damage this capsule of the prostate gland, because if it damages the capsule of the prostate gland, after surgery when patient will urinate, it will enter into the pelvic diaphragm. Okay, so this is very, very important. Okay, now I have one question to all of you. If patient's membranous urethra damages, where the urine will go?
into the deep
It will enter
perineum.
into the
Into
deep
the
perineal
Deep
pouch,
perineal
deep
right?
pouch.
perineal pouch.
Here it is covered by the peritoneum, okay, because urinary bladder is under the peritoneum. If the bladder is injured from this area, where the urine will go?
Peritoneal cavity.
Into the peritoneal cavity. Very good. Now another question. If the fracture or damage is in the bulbar or spongy urethra, spongy
Superficial
Uh,
perineum.
urethra, then
superficial
where the
perineal
urine will
pouch.
go?
Superficial
It
Superficial
will
perineal
perineal.
go
pouch.
into the superficial perineal pouch, and from here it can go into the Colles fascia, it can go into the scrotum, even it can go up to the
Abdomen.
anterior layer of anterior abdominal wall due to the Scarpa's fascia. But
Continuous.
please remember one very important point, that the urine will not enter into the latus fascia, because the Colles fascia and the perineal membranes, they are attached in such a way so that the urine will not enter into the upper part of the side. So whenever there is a damage to the spongy urethra, the urine will, you can find the urine in the scrotum, in the perineal cavity, even in the anterior abdominal wall. Okay, but it will not enter into the latus fascia. Okay, I will continue it later. 1 minute left. It is clear till now.
Yes,
Yes,
sir.
sir.